Hello health champions. Welcome to our channel Natural Recipes. Today we're diving deep into the topic of thyroid issues, how they begin, what causes them, and the early signs to watch for. Understanding the thyroid and its functions can help you take proactive steps toward maintaining your health. Let's get started. First, let's understand what the thyroid is and what it does, and at the end of the video we will give you tips to improve your condition. Located in the front of your neck, the thyroid is a butterfly-shaped gland. It produces hormones like thyroxine, T4, and triiodothyronine, T3, that regulate metabolism, energy levels, and overall growth and development. These hormones influence nearly every organ system, including your heart rate, body weight, and temperature control. Now that we know the basics, let's look at how thyroid issues can begin. There are several thyroid disorders, but the most common ones include hypothyroidism, when the thyroid produces too little hormone; hyperthyroidism, when the thyroid produces too much hormone; Hashimoto's thyroiditis, an autoimmune disorder where the immune system attacks the thyroid; Graves' disease, another autoimmune disorder causing overproduction of thyroid hormones. These conditions can stem from various causes, which we will explore next. Several factors can lead to thyroid problems. Number 1. Genetics. A family history of thyroid disease increases your risk. Number 2. Autoimmune disorders. Conditions like Hashimoto's and Graves' disease. Number 3. Iodine deficiency. Iodine is crucial for thyroid hormone production. Both deficiency and excess can cause problems. Number 4. Hormonal changes, such as those during pregnancy or menopause. Number 5. Medications. Certain drugs can interfere with thyroid function. Number 6. Radiation exposure, especially in the neck area. Let's delve deeper into each of these causes. Number 7. Genetics play a significant role in thyroid health. If you have a family history of thyroid disorders, you might be at higher risk. Our tips are: be aware of your family's medical history. Regular checkups can help detect issues early if you are at risk. Autoimmune disorders occur when the immune system mistakenly attacks the thyroid gland. Hashimoto's thyroiditis leads to hypothyroidism by destroying thyroid tissue. Graves' disease causes hyperthyroidism by stimulating excess hormone production. Signs to watch for: Hashimoto's, fatigue, weight gain, and depression; Graves', anxiety, weight loss, and rapid heartbeat. Managing autoimmune disorders involves regular monitoring and treatment to balance hormone levels. Iodine is essential for thyroid hormone production. Both too little and too much iodine can cause thyroid issues. Sources of iodine: food, seafood, dairy products, and iodized salt. Supplements, sometimes necessary, but should be taken under medical supervision. Here are some tips. Maintain a balanced diet with adequate iodine. Avoid excessive iodine intake from supplements without a doctor's advice. Hormonal changes during pregnancy, menopause, or even stress can impact thyroid function. Pregnancy can lead to postpartum thyroiditis, which may cause temporary hyperthyroidism followed by hypothyroidism. Menopause. Hormonal fluctuations can exacerbate thyroid symptoms. Our tips are: monitor thyroid function during pregnancy and menopause. Manage stress through lifestyle changes and relaxation techniques. Certain medications and radiation exposure can also affect thyroid health. Lithium and amiodarone, for example, can interfere with thyroid function. Radiation exposure, particularly in the neck area, can damage the thyroid gland. Here are some tips. Discuss potential side effects of medications with your doctor. Protect yourself from unnecessary radiation exposure. Recognizing early signs of thyroid problems is crucial for timely treatment. Hypothyroidism. The symptoms are: fatigue, weight gain, dry skin, depression. Hyperthyroidism. Symptoms: weight loss, anxiety, rapid heartbeat, Excessive sweating. If you notice these symptoms, consult your healthcare provider. Regular thyroid function tests can help detect issues early. Understanding how thyroid issues begin and recognizing the signs can help you take proactive steps towards maintaining your thyroid health. If you suspect any thyroid-related symptoms, don't hesitate to consult a healthcare professional for proper diagnosis and treatment. Thank you for watching. If you found this video helpful, please give it a thumbs up, share it with your friends, and subscribe to our channel for more health tips and information. Take care of your health, and see you in the next video.